People
Yeah.
are fasting and then they're going about their full work day. Absolutely
Yeah.
not, in my opinion, right? Like we need to be on the couch doing nothing. But if you're trying to do like a full day and work out and do all this other stuff, that is not safe.
Switching gears a bit, what's your view on fasting for fixing gut issues?
That is a great question. I'm actually probably one of the few people that doesn't love fasting. Maybe that's because myself, I haven't done it or loved
Yeah.
it. And when I say not a huge fan, I should correct myself in the sense of I do like safe and effective forms of intermittent fasting. But I feel like your question was long term fasting. Is that correct?
Yeah, there's very different opinion, but also different science. There's, some good science that, 72 hours plus can really help with healing the gut. But I'm curious on your opinion, and then I'll share mine. But it's good to get different opinions on this.
Oh, I agree. And I think it's always important to be challenged because that's how you grow, right? But I believe that I actually think fasting can be very beneficial, but like I said, it has to be very strategic. So one, with a 72-hour fast, I do believe that can actually reset the gut. But what I also believe is most people do it very incorrectly and
Yeah.
unsafe, right? Because people
Yeah.
are fasting and then they're going about their full work day. Absolutely
Yeah.
not, in my opinion, right? Like we need to be on the couch doing nothing. But if you're trying to do like a full day and work out and do all this other stuff, that is not safe. So I think I usually just go about saying like we're going to do it this other way because most people are not doing it to the T of what I think you need to do. Intermittent fasting though, and little small versions of fasting I actually do love. So intermittent fasting in the sense of you're eating enough calories throughout the day, but then you have only a certain hour in a window eating hour, right? And you stop eating
Yeah.
around 7 p.m., maybe even 6 if you can, and then you wait to eat for 14 hours, and then you have your breakfast in the morning. So I do like that. I think that can be really good for gut health. And then also just something simple as like making sure your meals are 2.5 to 3 hours apart can be really beneficial and help the turnover of your gut motility cells, right? So
Mhm.
that was a lot of words of saying like it depends.
Yeah. Yeah, no, I think and to summarize it, my feedback that I would add to this would just be that it's very different for men versus women, very different.
Oh, I love that. Yep.
And for women, if you're having hormone issues, maybe low progesterone issues or different issues within your progesterone and estrogen levels, fasting sometimes is the worst thing you can do when in fact you should be waking up and having protein. We are really overlooking this key part of the puzzle, which is the male and male fertility. So, what are you seeing when it comes to males playing a role in the infertility struggles currently?
Well, first off, I'm so happy you mentioned men versus women in fasting. That is something I emphasize so much to my patients, right? Like they'll be like, my husband skips breakfast. I'm like, well, we want to make sure he's eating enough throughout the day, but that's not as big of a deal as it is for you. So like, just
Yeah.
because he's doing it doesn't mean you can do it. So I love that you emphasize that. Two, when it comes to male fertility, I love that you have incorporated that in this talk because I am a huge advocate of focusing on male fertility. Not only does it matter for their sperm values, right? So concentration, motility, morphology. What I basically just said was how much sperm, what the shape is, and what the size is. Those things are going to matter, and those are found on a semen analysis, which one aren't done as much as they should be. It's like one of the easiest tests to do. I know for some men, if they have to go into the office, it can feel uncomfortable, but there are even at-home kits now that are pretty accurate that you can also do. So I'm like, just test that because it's just a good check to make sure you're having okay values. The other side of that, though, is a lot of the normal values aren't necessarily optimal. So
Mhm.
normal with hormones, honestly, I feel like with gut health and with
Yeah.
semen analysis does not always make it optimal. So our values of what is normal shifts based off what the person is average person's values are, right? So
Mm,
we're seeing a decline in fertility, and now we're
yeah.
are basing our values off of basically what the average is right now. Like, that's not ideal. So I like to use like old average values that when
Yeah.
fertility rates were a little bit higher. And so I'm using different values when I'm evaluating that. I do actually have a semen analysis. It's like a freebie that's in my Instagram link in bio. I know we'll talk about that later, but just
Yeah.
if you are like, how am I supposed to tell if this is optimal? I have that there. Um, the biggest thing I've seen drop actually exponentially is morphology. Morphology, like I used to even say above 14%. I don't think I've seen a morphology above 10% within the last year. So it
Wow.
is dropping, and I have seen it drop, like, actually. But now I will say we would love to get it above 10, but that is very profound, right? That's something that I've seen in like real time happen, which is wild. But I do believe that has to do with the environment, environmental toxins, um, and especially men who work like more blue collar jobs, or they're exposed to constant environmental toxins and they don't take any of the precautions. We're also seeing that very much so. But same with men who are constantly stressed, right? Like, I guess it's just give and take in what they're exposed to.